So Rhiannon, for somebody with high blood pressure, how would you modify exercise for them?
A client with high blood pressure, it's really important not to place any extra strain on their heart. So any exercise such as a shoulder press that elevates the weight above the client's head, or any elevation of the legs above the head, like a linear leg press, should actually be avoided. Alternate exercises include, instead of like a normal push-up, you could do a push-up on a wall because it keeps the head elevated. And also, instead of a bent over row, you could perform a seated row because it's working the same muscle groups, but it's just avoiding the extra strain placed on the heart. It's also very important not to give clients very high intensity exercise. They should be working probably around about 60% of their max heart rate, so as to not put too much strain on the heart.
And somebody with lower back pain, how would you modify exercise for them?
So a client with lower back pain needs to avoid any very heavy lifting, especially exercises like squats where they have a load placed on their shoulders will put extra strain on the lumbar area. So an alternate exercise for this could be a fit ball squat, where you put the fit ball up against the wall and have the client squat because it's still working the same muscle groups, but it's taking the extra pressure off the lower back area.
And what about somebody with a knee injury? How would you modify exercise for a knee injury?
So a client with knee injury, exercise such as lunges should be avoided because it has a lot of pressure placed on the knees. Clients could instead perform an exercise like on the leg press machine, where there is less pressure on the knees. They also may need to perform a shallower range of motion depending on how severe the knee injury is, depending on the individual. But yeah.